This podcast is brought to you by Firehouse Subs, the firefighter-founded hot sub chain with a passion for hearty and flavorful food, heartfelt service, and public safety. Ready for your next mission? Firehouse Subs is offering firefighters the opportunity to continue serving after service, now as restaurant owners. Learn more at firehousesubsfranchising.com.
This is Sons of the Flag Radio, brought to you by Fire Engineering Blog Talk Radio. Our mission at Sons of the Flag is to revolutionize burn care and the quality of life for veterans, first responders, and families. Sons of the Flag believes that the future of burn care resides in research and development. Our vision is to accelerate the process of testing leading technologies and pushing them into circulation for immediate use by burn survivors across the nation. We bring together passionate community leaders, pioneering physicians, dedicated first responders, and purposeful civilians to complete our mission. If you'd like to check out any other information about Sons of the Flag, you can always log on to www.sonsoftheflag.org or locate us and look us up on all social media by typing in @Sons of the Flag. You can also look up additional episodes by logging into Fire Engineering Blog Talk Radio or going onto YouTube and typing in Sons of the Flag. We're going to start tonight's show off by honoring our fallen brothers and sisters since our last episode. We also want to make sure we pause for a moment and recognize our fallen law enforcement personnel and our additional fallen military heroes. The fallen firefighters since our last show are Isaac Hassan Sr., Rory Swanson, Stephen Smith, Timothy Klein, Harold Cordova, John Forbush, Darren Banks, Jason Smith, Sean McAdam, Ryan Erickson, and Terry Cassidy. Let us take a moment of silence to honor these fallen heroes. So you've heard us talk a lot over the course of several episodes, and anybody who's encountered Sons of the Flag at any of our events, or encountered Bird or Sherry Landon, you've heard about some of the programs that we are extremely passionate about, and these are the programs that we help fundraise for, not just for burn victims, but we have several programs in place, such as Mission Reconstruct. And one of the programs that Sons of the Flag supports is called our fellowship programs. And Sons of the Flag, it's usually on an annual basis, will fund a burn fellow who will be educated in the methods to measure the implications of a burn injury, to include epidemiologic investigations, effects of current treatments, clinical trial methodology, and investigations into the mechanisms of injury with short-term and long-term effects. And so tonight I'm extremely honored. I was contacted by Sherry and Landon as we go through our monthly process of who do we want to interview. We want to bring people on here that understand the value and the mission behind Sons of the Flag and are really pushing us forward to the next level. Tonight's guest was pretty much a no-brainer. I don't know why we've waited so long to bring this gentleman in, or anybody like him in here. We want you guys to understand firsthand what Sons of the Flag is doing, and he's an integral part of our fellowship program. We have tonight UT Southwestern's very own Dr. Benjamin Levi. Thank you again for joining us and taking the time out of you. I know you're super busy scheduled to be here.
No, this is incredibly important. I wouldn't miss this, and having learned about Sons of the Flag over the last few years, this really is an incredible program and mission that you all do, and it's truly an honor to be here.
No, and so you hold, I'm just going to read a little brief bio about you, and I could probably make an entire episode about your biography and some of your accolades and accomplishments, but you hold the Dr. Lee Hudson Robert R. Penn Chair in Surgery and Plastic and Reconstructive Surgery, and you serve as Chief of the Division of Burn, Trauma, Acute, and Critical Care Surgery. You also specialize in acute and reconstructive burn surgery and scar reconstructive surgery. But most importantly, like we talked about, you work closely with our fellows on research. And I guess back in April, I didn't get the privilege. I got moved to admin last year, and so I'm on an 8 to 5 schedule. And when I was working my 24/48s, I was able to attend UT Southwestern and come meet you guys firsthand and shake y'all's hands and listen to what research is coming up and just really divulge and get some information from you guys and see what's really transpiring behind the scenes, right? We operate on this front line, but you guys are doing a lot of the work of what this entire mission's about behind the scenes. But Sherry and them took a tour of the UT Southwestern back in April.
Yes, yeah.
And from my understanding, it's the new lab, correct? And that's where all the current research is actually taking place right now, correct?
That's correct, yeah. Yeah, so I relocated here to Dallas in June of 2020 and brought our research program and started the Center for Organogenesis and Trauma. And we focus, and our mission really is to improve the lives of people who have suffered from injuries to the skin and musculoskeletal system through compassionate care, through rigorous science, through collaboration and connection. And that core is at UT Southwestern and has been one that, really came to fruition. And the reason why we relocated is because of the Dallas really being a center for burn care. Mm-hmm. And I remember during my recruitment here, hearing about Sons of the Flag, hearing about, the mission, and the people here are really dedicated to the full spectrum of burn care. And I could say, as a, burn survivor when I was young, to having been involved in burn research since high school, and burn surgery and reconstruction, really to be somewhere that has the ability to treat all stages of burns and to do the important research behind. There isn't any other place like here to be able to do that.
I'm real big on the why, right? And I think that's where society's everybody wants to know why. Why are we doing something? Why are we wired to do these types of things? And there's a survey out there. It's the Firefighter Rescue Survey. And the reason I like to tie this into this is because with the fire service itself, right, they're saying fires are going down, but burn injuries are still going up, right? Just because a house is on fire doesn't mean burn injuries don't occur, right? We have burns, thermal burns, electrical burns, various types of burns. With that being said, we all know how COVID is trapping everybody inside our house. A lot of people still work from home, and what we have seen is a rise in the number of rescues, and with these rescues are significant burn injuries. And what the numbers I want to kind of reiterate is that in just to date in 2022 alone, these are recorded fire rescues, and with some sort of thermal burns associated, there's been 317 recorded rescues to date in the United States, and that's only documented. That's not counting organizations that don't take part in this program. And it's a beautiful program. They've taken statistics and data from all over the place, and it's really showing that the time that we do in the pre-hospital setting until we get them to your care, and then when Sons of the Flag and you guys get involved, is that the numbers are increasing drastically. And one of the things that Bird has always talked about is the disparity in the amount of burns versus the amount of actual burn surgeons that are able to work on those patients. And that's one of his biggest passions. I think one of our biggest passions, and hence the whole fellowship program, is to kind of narrow that gap. And I think it's an extremely important gap that we've got to narrow, because burns are not going away.
That's right.
And I'm actually surprised to hear you say that you are a burn survivor yourself.
Yes, I am.
You care to talk about this for a second?
Yeah. So when I was 12, we were with my family, and we had a campfire outside. We at that point lived in the Midwest, and as I had seen my dad do in the past, and campfire kind of smoldering, using some accelerant to get it back going, and got a little bit too close to it, and my leg caught on fire. Ran at first and remembered the stop, drop, and roll. Had a little bit of trouble getting the last part of it out around my sock, and I was lucky my brother came out and was able to. It actually happened to be, I think my dad had like a really old car that had those bumpers that stuck out, so there happened to be a rag sitting over it, so I was able to use that to kind of get the fire out. And I was taken initially to just a local hospital that wasn't really able to care for significant burns, so I was then transferred to a center of excellence like Parkland Hospital in UT Southwestern, but it was Loyola University in Chicago.
Right.
And there I was inpatient for several weeks, underwent skin grafting surgery, was cared for by an incredibly compassionate and skilled surgeon who also was a scientist. He also ran the Burn and Shock Trauma Research Institute, and I still remember, that team there, the surgeon, the nurses that were there, the pharmacists, the nutritionists, the therapist. What I love about burns is it is that team sport, and all the people there, they'd all have been there for like at least 10 years, and it's just that dedication to the patients that were there. And I remain close to those people to this day. They are mentors, friends.
Yeah.
And, obviously when I left the hospital after that and the surgeries, I never wanted to set foot in that environment again. And when I was looking for a job after the summer before going into college, the surgeon who had taken care of me said, "Hey, why don't you come work in my laboratory?" And one of the projects that actually I was a clinical patient enrollment for was using this compound to make skin grafts stick. And so they were studying this then in the lab because it hadn't been approved. So I was in the lab and I was studying the same compound, and really to see that bench to bedside connection.
Right.
And then now it's actually a compound that I use on almost all my burn patients every day. And so to see, that tie behind, as a surgeon and as anyone in the field, right, the first responders, we can help people one at a time, and to also be able to ask scientific questions that if you make an impact, you might be able to help, hundreds or thousands at a time. And the ability to do both of those things to me really was an inspiration. And to get back, I don't want to forget when you mentioned your fellowship program, that you are right. There are not enough burn surgeons that are out there, and for whatever reason, it's one of those fields that there aren't a lot of major burn centers, and so that people aren't exposed to it, and then they don't find mentors. And when I was thinking about coming here to relocate, one of the people who I met with that was so inspirational into me coming here was actually one of the previous Sons of the Flag fellows, Audra Clark.
Yep.
And she was one of the fellows in the laboratory at the time, and then a resident. And so when I came here my first year, she was actually our burn fellow, and she was the first person I hired to then, join our burn team. And she is a rising star in the field and will be someone who will continue to have an impact. So, again, that's something that it's hard sometimes for people to see the long-term effect. Clearly,
Right.
You all see that it's not, we're often emotionally drawn to how can I, run to that burning building and help people right now.
Yeah.
There are also several steps back that make these huge impacts that you all have supported that has made a tremendous difference.
And I'm a firm believer, I don't believe in mandation, but I believe in education, right? And the more that we can educate individuals, one, based on burn safety, right? And what household safety, tasks or precautions can you put in place to reduce the possibility, right? Especially on the pediatric side.
Yeah.
I've got 3 young kids, and that's one of my biggest fears. And, even to this day, when I walk into a kitchen, I see the pot handle facing the wrong way, and it's just one of those things. In my mind, I just know you twisted, right? But I think if you do educate, right, and you reinforce these educational, like you said, you went back to what you were taught about stop, drop, and roll.
Yeah.
When we reinforce the education part, then we're starting to make progress, and we're moving forward, and we're not becoming stagnant. We're becoming a little bit more progressive. And I think, kind of also talk about people don't see it until you need it.
Right.
Right here in just this area alone, we always have UT Southwestern Parkland, and then up where I'm up in Salino, but we also have MCP, right? And so those are the only burn centers, and nobody thinks about it until it happens.
That's right. Yeah.
And then it's always now, well, what now, or what if, or what needs to happen now? And we're never thinking. I mean, I should say we're never thinking. Society is just not educated enough to have that forward-thinking process of, well, if I do have a burn, where am I going to go? And I've already, unfortunately for my family, they're getting a lecture from me all the time. I go, you're going to go here, we're going to go here. They're like, why are you always thinking about this? I was like, it's just the pre-planning part in me. I want to have everything lined out. And I think the more that we educate, though, the younger generation to the older generation, we're going to be able to close that gap. And like I said, the stuff that you guys are doing at UT Southwestern is revolutionizing. It's changing. And like I said, with Sons of the Flag, helping push this thing forward. I always like for people, whenever they donate to a charity, it's so hard sometimes to explain, like, here's what we're doing. But when they get to hear it from your voice, we can go to a Susan G. Komen walk and see that your money's going to Susan G. Komen or breast cancer research, right?
Yeah.
But when you guys come visit your burn facility or see the research and see the actual results that are being pushed out and seeing the transformation of lives, then people understand when we come to you and asking you for the donation, this is the why. And I want them to understand that, because I think of Zach Sutterfield, one of our biggest success stories we have right now. Every time I look at Zach, I'm more and more impressed. He just had a birthday, I think, yesterday or the day before.
Yeah.
And he's now back to his normal life because of the research that all of us have been pushing forward to get him his new thumb and to get him a better quality of life. And I think it's an amazing thing that you guys are doing. And I think it starts with the fellowship program.
Yeah.
Because if we don't have doctors in these places, that we don't have people like you and everybody else there to provide the ultimate care and the quality of care.
Yeah.
That will hopefully have a story like you that are able to come back, work the bedside. I love the idea, the bedside back. I love that just because you saw it firsthand.
Yeah, and I think one informs the other. Like I don't think I would be able to continue to innovate in the lab if I am not still a burn surgeon, and vice versa. I don't think I could be as good of a surgeon if I didn't also have the research. I think what's so interesting about burn care and burn research also is that the questions are so fundamental. And if you think about wound healing, which is ultimately what we're trying to do, and actually the initial plastic surgeons, where plastic surgery came from, was from World War I. There were a bunch of fighter pilots that had really horrible burn injuries. And there was a group of people that really wanted to focus on helping them. And that's really where the initial birth of plastic surgery came from, to reconstruct. There's a book about them and Archibald McIndoe and the original plastic surgeons that were doing that. And the questions that we're answering, even though it does impact burn patients, any wound, right? Even if you're having cancer surgery, right? That's still an incision wound and wound healing, and how the cells respond and heal a wound is the same thing, whether you have a cancer surgery, a hip surgery, and so I think that the questions that we try to ask in our laboratory are fundamental questions that will help burn patients, and they will help anyone with any trauma, injury, any surgery, any other type of insult to the body where it requires healing to occur. It's the same immune cells that respond. It's the same local stem cells or progenitor cells that are needing to repair something. And so that, I think, if we take a step back, and think about it that way, where even though burn is somewhat of a smaller field, what we're doing and the advances that we make in burn care impact, patients that I take care of that have, need melanoma reconstruction or, develop bad complications after hip replacements. And it all really ties back to these fundamental questions.
And I've never even thought about that until you literally just put it into perspective like that. I mean, what you are doing has effects across the spectrum now.
Yeah.
I never once ever would have dreamed that the research that's taking place there will also affect other types of ailments or, like you said, other wounds.
Yeah, and I could give an example. Like one of the devices that we're developing right now is a camera that assesses skin viability, and it does it by measuring tissue moisture. So as it turns out, if I'm trying to look at a burn and say, so one of the things, like you mentioned earlier, is that there aren't enough burn surgeons. So the Department of Defense is interested in, if there's a mass casualty event, how do we have other people that aren't trained burn surgeons give them an additional information to assess a burn, and whether it's severe, needs surgeon, whether it isn't severe. And so we asked that question, and what we noticed was that certain tissues that have more moisture to them are less deep of a burn, meaning not as severe. Whereas wounds that have a more dry appearance often are deeper injuries. And as it turns out, that type of camera device was out there for people assessing forest fires. So on the West Coast, when they're looking, where forest fires are going to go, they use these cameras that assess foliage moisture, and they look at the shortwave infrared imaging, and so they can say, oh yeah, that area over there is dry. That's where the fire is going to spread. So we said, well, can we take that same technology and apply it to burns? Because we think that the dryness of a wound tells us a story about whether the skin is alive and will be okay versus it's dead, needs surgery. And as it turns out, we were able to validate this in animal models in the lab, and now we've done first in human studies at UT Southwestern and Parkland to show it can do that. And that same question can be applied to venous stasis wounds. It can be applied to diabetic wounds, and so that's the kind of the next step of how so something that again started out just in burn wounds, but really can apply to any wound, and diabetic wounds being more common, right, than burn wounds.
Yeah.
So really these questions, yeah, it does have an impact globally for patients, not just in our burn field.
That's absolutely amazing. I was going to ask you, where do we stand with current research? Are you obviously we're progressing forward because I just learned some new stuff, but where do you think overall research as a whole? So do you deal with just UT Southwestern alone, or is there do you deal with the other organizations? How do y'all kind of collaborate and work together?
Yeah, and that's actually, one of our, reason why we have collaboration as part of our mission statement for our center is because that really is so key. Like, back in the day, labs, would maybe be you think of a person sitting with a, pipette and thinking of their ideas and proving it themselves.
Right.
These days, you can't do that. And the most impactful science, just like, if you think about teams, right, diverse teams are always better at solving complex problems. And so we approach science that way, where we want to have diverse areas of expertise. And so we collaborate a lot with labs at the Department of Defense. The Davis Group in the Department of Defense is one that we've worked with in the Department of Surgery there now for over 10 years. And they look at a problem that we've been working on as well called heterotopic ossification, which basically means bone forms outside of the skeleton where it's not supposed to. And we see this in burn patients and in patients with blast injuries. In fact, in the recent conflicts, it was seen with blast injuries up to 80% of patients with blast amputations. And so when we started looking at this in my lab in its previous location, we started having some interesting findings and publishing it. The Department of Defense reached out. They said, hey, we think that this is interesting. We should work on this together. So we then started to work on identifying what are the key gaps of knowledge in this area. And so with them, we identified, early diagnosis is a problem. Right, so we collaborated with them on that. We then also worked with a group at University of Michigan, which is where my lab previously was, that had expertise in imaging modalities to detect this problem early. That's also where we started our camera imaging device was at University of Michigan. Then we also understood that pain is a big area that drives a lot of normal and abnormal wound healing. And we collaborate with groups at Johns Hopkins, Aaron James and his lab, on looking at what is the role of sensation and pain on wound healing, both normal and abnormal, in burn wounds and tendon injuries, musculoskeletal injuries. Then we've asked questions around the immune system, because the immune system is so important in this role. We collaborate with Dr. Gallagher and her team at University of Michigan. We've asked questions about the role of the other types of vessels that are present in an injury site. So there's blood vessels and lymphatic vessels, and Mike Dellinger and his team at UT Southwestern, we've been collaborating in that. So there are very few days and weeks that go by where we're not on conference calls and meetings with people outside of our institution, because we do want to bring in the expertise from all these different areas, because that's really where innovation occurs and why our science has been able to advance.
That's amazing. So are these like contractual agreements, or are they just like basically normal agreements that you guys have with other, you built over networking over the years.
Yeah.
But they're not contractual based, right? They're
Well,
all
it's interesting. It's a good question. I mean, some of it has been, just through like contacts. So, for example, the camera device, we're also working with a group down in San Antonio Military Medical Center, Rodney Chan and Lee Cancio and their team. And so that was just basically like, hey, we have this device. We think that it's going to be impactful for burn patients, and we'd also like to apply it to, groups that take care of military burn patients. So we should do that with you. And so then we applied for a grant through the Department of Defense. And so we have a grant with them.
Okay.
So that, there is a contractual part of that. Where it started, though, was, before the funding was like, how do we work together to solve this problem? So usually it starts with a collaboration, generating preliminary data that isn't funded. And then once you get some compelling data, if the hypothesis looks promising, then can we apply to get funding to do that line of research, through the NIH or Department of Defense or, private industry or private, groups that are interested in funding that type of research topic.
Wow. So I work in the pre-hospital setting, and I know a lot of what occurs in the pre-hospital setting could have a detrimental effect, especially when it comes to long-term care.
And beneficial.
Yeah, exactly. It could be beneficial, and some of the stuff that we run into. And with that being said, are you seeing stuff regarding patient care coming from the pre-hospital setting having benefits or value? Can we talk about it a little bit?
Yeah.
Because I know sometimes when we transport patients and we transport patients to these burn centers, that's usually the end of it.
Yeah.
We don't have any follow-up. But what I think would benefit me and other people to hear that, yes, what we're doing in the field, if we're doing the correct Parkland burn formula and the correct, prediction of total, burns, if we're doing that stuff correctly, is it having a positive, are you seeing more positive outcomes with the more aggressive pre-hospital care that you're seeing from some of these medical agencies right now?
Yeah, no, I think anytime that you have more connection and communication between all parts of the burn care, that patients do better. And 100% that the work that frontline providers do for our burn patients make, a huge impact. If it weren't for you and people like you, we wouldn't, be able to take care of patients at the next step. So whatever I think we can do to continue to foster that collaboration and educational events together, because we also learn from you. So I think it has to be, this opportunity. In fact, we just had a trauma survivor day at Parkland the other weekend, and we had one of the firefighters that was a first responder on the scene, building that blew up outside of Dallas. There were several firefighters that were injured, and he came and spoke about his experience. And so those types of connections, right, where we're learning just as much, as anyone else by hearing these stories, and, having those joint educational opportunities. And we have specific, part of the ABA criteria, the American Burn Association criteria for us being a verified burn center is to have, that outreach and that connection to the fire community. And that's why one of the things I love about the American Burn Association, that meeting is, it's one of the only meetings that you do also have the first line responders there.
Okay.
They come to the meetings, burn survivors come to the meetings, scientists, clinicians. Those types of events are needed to move the field forward, because there are, again, questions that you will see and have that I don't even know because I'm not there.
Mm-hmm.
So, yeah, I do think what the work you guys are doing is tremendously impactful and helpful.
So for the burn care, on a nationwide scale, where do you think nationwide where we stand? We know what UT Southwestern's doing, but overall, because we obviously partner through Sons of the Flag, our local task force members do partner up with local burn centers and then their region or respective cities. On a nationwide scale, where do you think burn care is currently standing?
So I think in general, trauma as a field, I have this slide that I always show when I give talks about our research. If you look at like the amount of funding that the government, the NIH, has for cancer, like you mentioned, like Coleman Walks, for heart disease, diabetes, that amount, of funding is incredibly high. For trauma, there is no institute, right? Just there's a National Cancer Institute. There's, musculoskeletal disease. There isn't an institute for trauma. So the amount, and if you look though at what the most costly diseases in the U.S. for, the cost of cancer, diabetes, heart disease together are about the same as trauma by itself.
Really?
And then if you look at like the years of life lost, right, because trauma often affects younger people, or work years lost because it's affecting younger people, it is much more, tilted in the trauma and burn area. And so, what I really think now, the Department of Defense and through the Congress, it's called the CDMRP, the Congressional Directed Medical Research Programs, they do fund trauma and burn related research. And I think that that's really what, the focus, like you're doing, right? Grassroots events like this where you're spreading information to get people knowledgeable about it, to support this type of research and clinical care. That's really, I think, where for us to continue to do impactful research, it needs to be something that is funded and supported, that will allow for connections, collaboration, important scientific experiments. I think that's really where, right now as a nation, I would say burn care probably has not advanced as quickly as cancer research, because there hasn't been there aren't as many labs, as much funding supporting it. And so anything that we could do to continue to spread that support to people in those areas. And again, I think it has to be this shift in our culture with how we view it, where it's not just burn, right? It's wound healing. And that's something that almost everyone has some experience with in their lifetime.
Right. I mean, because you sit there and talk about it's having a conversation sometimes with individuals about burn. It's almost taboo, right? It's that talked about subject we just don't really want to talk about. And one of the things that Bird always told me when I joined Sons of the Flag was it doesn't have that sex appeal, especially on the doctor side, dealing with this, because obviously you guys can go into plastic surgery and be much more lucrative, and even talking about burn care as a whole, just on a nationwide topic, it's just something you don't think of. We've always talked about amputations you can hide.
Yeah.
Burns you cannot hide. And it's almost something we don't want to talk about until the moment it happens. And then again, it goes back to, now what do we do?
Right.
What do we do? What have we done? And that's what I think the beautiful thing about this organization is, that we're taking leaps and bounds to erase that stigma, erase that nasty thought about burns, and putting the money to the work towards you guys, and allowing you guys to take the lead and make these changes to where we can have maybe an organization that's nationwide. I would love for it to be Sons of the Flag.
Yeah.
That's that institute, but that'll put us out of business. And as Bird says, the day we go out of business is a great day, because we've accomplished our mission.
Yeah.
But to ultimately have some sort of foundation and organization that is standing there along with multiple grassroots organizations like us, and making that lead charge, it's terrible we're not there yet.
Yeah, and I think you hit on it with how do you get people to, or make it more compelling to go into, because it's maybe not as compelling as some other fields in surgery or in medicine in general. And I think for me, there are very few fields where you get to really take care of the entire spectrum, where you get to take care of kids, you get to take care of adults, you get to take care of simple things, you get to take care of really complex critical care. You could do simple surgeries, you could do very complex surgeries. That span, and if you think of, go back to the example of cancer, there's a medical oncologist and a radiation oncologist and a surgical oncologist. For burn surgeons, no other really doctors, right, that we do the whole continuum of care. And that to me is so unique, where the patients I see and I follow them through their acute phase, and then I'm seeing them years out in clinic during their reconstructive procedures. That continuity, and to see patients as they grow up or grow old, that is unique to what we do. And I think for me and anyone who really comes on and is exposed to burn care, I think that's where the excitement lies.
Yeah. So let's talk about the fellowship program just for a little bit.
Yeah.
Basically, we talked about it at the beginning of the episode. We try to do it on an annual basis, given money, but we're really trying to push this initiative of introducing residents into this program, into burn care. Tell us about your role along with Sons of the Flag in that fellowship program.
Yeah, well, I mean, this is truly critical, because if you think about it, it used to be that academic institutions used to require that residents would take 2 years off to do research, and it used to be paid for by the government. That went away. And when that went away, it became much harder for us to inspire residents to come into the lab and then to support them to do impactful research. And so what the fellowship has done is it allows us to guarantee that we have someone who wants to go in and change and improve burn care can come into the laboratory. We will help them find a research project, usually ones both that we have ongoing as well as ones that they think of up on their own, and they can just focus those 2 years on research, right? And this is really the last time, once you become a practicing clinician, it's very hard to learn those skills of science because you're managing so many other things. This is the one time in their life they can really be protected and just focus on how do I think critically? How do I set up scientific experiments to answer crucial questions? And so during that time, they're advancing research that's ongoing, like the camera device I mentioned to you. Johanna Nunez, who's one of the fellows, is working on that right now. And when she goes out and is an independent burn surgeon scientist, she will ask questions that she'll know how to answer now because she did this fellowship. Right. And so it's one thing. All of us have good ideas, but if you haven't taken the time to put in the 10,000 hour rule to master something, what it takes, if you don't have that time in the lab to do that and have the support from Sons of the Flag, we're not going to have people out there that will know how to answer the questions, right? And that will be skilled enough to write grants to get funding to answer those questions, to hire the people to help them answer those questions. All that comes from them having the support and time to do that, and that comes 100% from this fellowship.
That's amazing. So, yeah, I mean, the research part, just knowing that you said 2 years, dedicate to just extensive research, and I'm just sitting here trying to think about it. I mean, that's one, it's an extreme dedication, but two, some of the innovative ideas and the forward-thinking progress that y'all are making just by coming out of this program. I think it's proving its true success, and I think it's a beautiful thing to see. No, go ahead.
Yeah, I was going to say, actually, going back to Audra Clark, who's the fellow, who basically convinced me to come here, was our first fellow, our first hire. She was the one then who was on call when that building exploded, where we had, multiple firefighters that were injured and came into Parkland Hospital. So, I mean, it is full circle. This impact is real, and it's not just, impact of like one patient. It's, if you think of her career, right, it's going to be over, many years, and all the patients that she's helping, and all the, and then she's also involved in education through our, she's one of the associate program directors for our entire residency program now. And our program director, also Kareem Abdul Fattah, is also a burn surgeon and involved in the education. So that education that they have and knowing how to train people, not just on how to be surgeons but also how to be scientists, comes from, again, these types of fellowships.
So if you had one piece of advice, so a lot of people that listen to this program may be working in the EMS field, and a lot of times what people end up doing is a transition once their career kind of runs a path, or they hit injuries, or hopefully if we have a younger audience listening, if you had a piece of advice for somebody that were to follow your career path, what advice would you be giving them right now? Because obviously yours came from a personal experience, that a personal experience led to the next step by being invited into the research aspect with the doctor, and it just kind of seemed to just grow from there. What advice do you have somebody who obviously doesn't have the firsthand experience that wants to pursue this type of path?
Yeah, it's a good question. I think you touched on it at the beginning where you said, what is the why, right? And starting with your why. And I think it also gets back to people do well at what they enjoy doing. So I think, we often get stuck in this loop where we think we need to get something to be happy. And if we take a step back and just say, okay, what is it that I enjoy doing, right? And I think for a lot of people in your field, in our field, it's helping people, right? And so what is it that, you can do to help people that you also would enjoy going to work every day? Because if you could align those two things, right, of what you enjoy doing with what you get to do at work, that I think is where you find your zone of genius, right? And so if it is, helping people in burns, find a way to do that, right? Maybe it's not, there are lots of ways to do it. If it is helping trauma victims, whatever it is that you find, every day I get up and I'm excited to be here. And I sense that with you and with Bird and everyone who's here, Landon. It is something that is part of your fabric and who you are. I think as long as you focus on that, then every day, is exciting, and you're able to I think work past any of the challenges that come up.
Right.
Right. And I think I'd also say just to, we've been doing this mental fitness program with our group called Positive Intelligence. And one of the big things it talks about is how do you, have resilience. And I think in this day and age, we need to be resilient, and it's about, recovering faster. So, so if something that takes you off your, game, or takes you off of your, and you think of it like a, missing a shot at the end of the game, how do you get back? And if you look at elite athletes, it's not always the ones that make the most shots. It's also the ones that can recover from the missed shot to get back to make the next one.
Right.
Right. And and I think if you're in a job that you really love doing, and you're supported by people who are also excited about that mission, it's really easy, it makes it easier to recover, because we are all going to have those events that take us off. But how do we get back to center, and finding the things that we love doing, and other people that also, we like doing those things with, that I think is, for me, the most important.
I liked how you talked about, waking up and being willing to almost face challenges every single day. And, your profession, my profession, Bird's profession, we've encountered those types of challenges, right? And one of the things that my fire chief always talks about, we're problem solvers.
Yep.
When we're given a problem, the public, as you know, we don't get to tell the public, well, I just don't know today.
Yeah.
I don't know what to do. And so we've got to find a way to overcome. And I think that's one of the things that Bird's always instilled. There's always a way.
Yeah.
There's always a way. And I think that just listening to you, the way that you talk and the way that you speak about what you've done, and the way that Sons and the fellowship and everything's kind of coming together, there is a way. When there's a challenge, that each one of us rise to the next challenge. And I think it's a beautiful thing to be, that we're actually witnessing firsthand.
Yep.
That each one of us, you guys have a challenge, and Sons of the Flag says, how do we meet your challenge?
Yep.
Well, we need this. Okay, let's rise up to your challenge. And guess what? Y'all got a new challenge. How do we meet this? And I think it's a constant back and forth, and I think it's a great thing. And that's one of the more unique things about Sons of the Flag, is that we're not just stuck here in Dallas.
Right.
I want to say we're in over 30 states now, which means that we have 30 task force members that are required to partner up with a local burn facility or local trauma facility and build a relationship.
Yep.
And it goes back to what you were talking about earlier, just building those relationships and solidifying that foundation and getting your people aligned up. That way, when something does occur, that you're there and that we have the people in place, and kind of all of it meshes into one. And that's one of the unique things about Sons of the Flag, is that we've really building that foundation.
Yep. Yeah, and even hearing it when we had the lunch the other month about, there was, I think, a patient down in Florida, but wanted to care in Dallas, and so those types of connections,
right,
are really what we love doing.
No, yeah, and we had Dr. E.J. Caterson.
Oh yeah.
He's one of our.
I know him.
He's a fantastic individual.
Yeah.
I
interviewed
him, I think, back in August last year.
Yeah.
And just the stuff that he's doing with the pediatric side.
Yeah.
And then one of the things I talked to him about, and I wanted to ask you about, because obviously mental health is a big issue.
Yep.
And you were talking about, the resiliency. How do you and your team cope on the mental health side? Because you're obviously seeing stuff post, what we see as a first responder, you guys are seeing the prolonged effects of it, right?
Yeah.
How do you guys, keep your mental health in check? How do you guys do your checkups on each other, and keep that resiliency, moving forward?
That's an incredibly important question, and especially I think, these last 2 years with all the things that we were seeing. I mean, it wasn't just COVID. The number of burn patients never went down; it went up. And in fact, when we had that freeze here, in 2020, we had over 65 frostbite patients in our burn unit. So how do you? Yeah, how do you build resilience both individually and then with the team, and the mental fitness? And so one of the first things I did when I got here was I read the book that I mentioned earlier called Positive Intelligence, and it is also a program that is a mental fitness program. And the idea is that, like physical fitness, mental fitness is something that you need to exercise and practice every day. And if you don't, you'll be out of shape. And so what we did is we connected with an executive coach that I've worked with for years, who's phenomenal, named Barbara McMahon. And she had, through a grant, learned this positive intelligence program. So basically we get an app on our phone. We watch a video on the weekend, and then we meet in pods of 3 or 4 other surgeons when we started it. And we talk about what we learned about that week, and then every day on the app you will do mental fitness exercises. And the idea is, if you do 15 minutes a day for 6 weeks, you can actually train your mind to respond in a more positive way to things that come up that are difficult. And it's just in 2-minute blocks. So for busy surgeons, right, busy EMS, you can do it walking to your car, walking, or from here to there. And so it's not like I have to sit here and do exercise for 15 minutes. 2-minute blocks, that's it, right? And every day has a different topic. So one day will be about how do you recover faster. One is about, not judging yourself or judging others. How do you focus not so much on if today were the last day that you were here, how would you go through that day? Not necessarily in the idea that what would I do that I've never done in my life, but how would I treat this person if today were my last day?
Right.
And so it gives you these exercises every day for 6 weeks, and then you keep the app. And so then I continue doing the exercise. So I did this over a year ago. I still use the app every day. And the pod that we have, we still send each other texts of positive things that we're doing. And then we connect with the coach and our entire surgery team twice a month to just check in on people, what's working, what's not working with this, and how can we be a support of each other with all these, challenges that we're facing coming up. And when we started it, we just did it with our division. Now we've actually offered it to our entire department. So over close to 100 people now have gone through this program. It's starting to spread to other institutions.
Awesome.
Loyola, University of Michigan, MGH is interested recently. And the other part of it is we're now offering it to families of our faculty. And because a lot of this stuff is also tied to, it's all one continuum, right? Like your mental fitness and how you come to work is also related to how you are at home. And so spreading these types of, so everyone has the same common language about mental fitness, and being able to talk about it and be like, hey, I noticed that you seem to be, they talk about saboteurs and sages. Saboteur, things that get in our way.
Right.
I noticed that the saboteur is, bothering you today. How can we help you shift to a more sage-like response? So it gives us that opportunity. We have that common language to help each other in times of stress.
I think that's awesome, because that's the key thing that I think a lot of us, I shouldn't say a lot of us, most people I think would miss, is the family aspect.
Yep.
Especially, even on the burn side, mental health side, whatever it may be, families are also victims in the entire process. And I think that's one of the more important things we've got to remember, is that when we're going through these tough times and tough trials, and, we deal with these things day in and day out, our families deal with it too.
Yes.
It took me a long time for me to realize some of my, I guess, demons, issues going on, until my wife had some long, hard conversations with me. And I thank God she did, because you get those little blinders on, you think everything's, copacetic, but it's really not. And, being in the profession that you guys are in, the profession that we're all in, and we've got to keep that thing in check. And I think you guys sound like you do a phenomenal job. And that's one of my biggest concerns with anybody, burn victims, first responders, military physicians. And I talked to Dr. E.J. Caterson, the same thing about it. How do you deal with it? Because it's huge. Because if we lose one of us, then we've lost so much valuable information. We've lost so many great resources, and that resource and information that's lost is going to hurt the next patient. Because we have some stuff that I tell people, we're always meant for more. Everybody's always meant for more. But what you have inside of you is going to benefit you, guys. You're going to find something eventually one day that's going to take research a whole different direction.
Right.
And if we were to lose that, then we would be stuck. We would be stagnant for a while until somebody else came along.
Yeah, and I think the fact that we're even talking about it is really so important too, right? Because I think there's always been the stigma, right, for surgeons, first responders about mental, and I think the way that the shift I think that has helped and with this program is if we think about it as mental fitness, right, and you think about it like physical fitness, where it's not, it's not something that people are just born with, right? It takes constant practice and attention in the same way that your physical fitness does.
Yeah.
Brain is another organ, just like your muscles. I'm a runner. I wouldn't be able to go out and run, a certain speed if I hadn't been training for the last, months or years, right? The same thing with mental fitness. Some of the weights, and I think also recognizing that some weights that we have to lift, right, with our minds. So like a mass casualty event, for example, that comes in, right, that is going to be a heavier lift.
Right.
And so even if you are extremely mentally fit, it still is going to take lots of time, attention, and practice to get through that event. So I think just even us talking about it, having a vocabulary around it, giving people the resources so they know where to go to work on it is really important.
And I love the way you put it. It's a mental fitness, like you said. It comes back. It's a program. You've got to keep working at it, and it doesn't come overnight. That's why that's why we tell everybody you got to go to the gym. You want to achieve what's your goals. You got to keep pushing forward. And I think the same thing goes with the mental side. So with that being said, we're going to kind of slowly wrap this up. We're getting close to the hour now. Yeah. With Sons of the Flag going forward, you deal with us directly. Yeah. I've asked some of our burn survivors, and I hate calling them survivor, but they're our burn hero. They're our heroes. They do a lot for us. What do you guys want from Sons of the Flag? What can you guys see us going forward to help you guys achieve your next mission? What can you expect from us, and what are you wanting from us? Yeah. That way, if people are listening and they're like, man, I want to help this mission, and I know how much I want to start donating money-wise to help them achieve that. What do you want from Sons of the Flag going forward to help you guys?
Yeah, I think the continued support for research, both with the fellows that are going on to be burn clinicians and scientists, and then also there are non-clinical researchers that also have incredibly impactful work that advances the field, and a lot of the best and brightest minds are some of the they're PhDs or they're involved in becoming PhDs. So and they have a different skill set, right? So they may be able to look at these things differently, ask different questions, use different techniques that we may not have, right? Because they've researchers may have been they'll be in lab for over 10 years for some of them. Like I just recruited someone from Johns Hopkins who's incredibly skilled with looking at single cell sequencing, and so he can define on a single cell level how cells are responding to an injury. And so he could answer questions again that like apply to all types of wounds, even though we're looking at it in burns. So I think that support for people in research, for the actual research that's being done, to prevent the complications that we see with patients with big burn injuries, to develop devices to assess burn wounds, those things that are really the foundation of research for patients with burns, and that can then be applied to anyone with a wound. I think that to me is the where culture change is, right, and change on a transformational level.
Right.
To me, that's where it's at. Obviously, also any support for any burns hero is incredibly valuable, whether it's getting them their reconstruction, getting them the mental health support they need. When I think though on where can the biggest foundational shift be, I do think that's in the basic research.
Okay, perfect. I love it. So you heard it right there. A couple quick questions for you. If there was a different career path that you could have taken, what would you have done?
I really did well. In college, I had thought about being a special education teacher, so I majored in Spanish, and I thought that I would work in a community that had a high Spanish-speaking population, and I would be a special ed teacher. And I'm glad that I majored in Spanish and speak Spanish because I get to use it very frequently at Parkland UT Southwestern.
I bet, yeah.
And so that was where I initially thought I was headed. If I hadn't been a surgeon and still was in medicine, I think rehabilitation medicine is another area that I find fascinating. And again, it gets back to working with the burn heroes when they're on the other side and getting them, rehabilitated. Those are the two things that have always, spoken to me.
All right. You've already mentioned 2 books.
Yeah.
What's your favorite book that you would refer people to read?
So, so Positive Intelligence is one that I've found incredibly impactful. We talked about Why, Start with the Why by Simon Sinek is another great one. I love reading about just nature. There's one I just read called Blue Mind, which talks about our connection to nature and water. Okay. And then actually the other one, Chris McDougall is an author, has written Born to Run and Running with Sherman. Both of those are phenomenal books that I have enjoyed and I think have good life lessons.
Sorry, I'm writing them down on my list right here.
Yeah,
when people say stuff, I got a list of stuff I got to start checking out. So
yeah.
It could be any advice, but what's one piece of advice you would just give that you could just give anybody right now? I don't care if it's medical research, life. What's one piece of advice you'd give to somebody listening?
Take the time to slow and appreciate all the great things that are present and in front of us. I think often we get so tied to what is the next thing that I'm going to accomplish, and really, and part of what the mental fitness training is about too is if you just take 2 minutes, right, and just go outside and look at a flower, look at a tree, pull up a picture of your family, loved one, of a landscape that you love, and start your timer. Just take those 2 minutes and only focus on that, right? Don't think about all the other things in your day, and then go back to your work. It completely resets your mind, and I think that, along with gratitude and again thinking of all the wonderful things that just to be able to walk to your car, right? The things that you can do in a day that some people may not be able to do, and just appreciating the wonderful things that you can do, not focusing on the things that you can't do, and enjoying those moments. I use a gratitude journal every night. I bought a one for my daughter, so we do it together. And so I think living a life of gratitude and purpose and being appreciative for those things along the way, and not, we actually talk about, same with burns, don't keep your hand on the stove.
Right.
Same thing with where you put your mind and your focus. Don't spend so much time on the things that aren't working or that frustrate you. Also take the time to really appreciate the incredible things in front of us that are there.
Man, I don't think you could have said it better than that. That's perfect.
Thank you.
Dr. Levi, thank you so much for your time. It's truly an honor to sit here and speak with you. Like I said, just learning a little bit more about the research firsthand about what's happening on the burn care side and, what Sons of the Flag is doing along with UT Southwestern. This is life-changing stuff. And, we're having these conversations and I think about all these individuals that I've come across that have endured burns over the years, and they keep running through my mind. I'm thinking about R2 and Zach and just the positive changes that we've seen from the research that you guys have done and the way that medical treatment, medicine has advanced over the years. And I'm sitting here, they keep going through my mind as we're talking, and it just kind of puts it all into perspective, and that this entire thing that we're doing here is real. Real lives are always at stake. And so to everybody listening, this is not, a plea for your money, but this is a plea for you to take a chance, look at us, because most of the people that will listen to this podcast are in the fire service. Yeah. You are more than likely going to be more subject to being dealing with burns. You're going to deal with victims that are obviously going to be burned. Yeah. You're going to be running EMS calls of kids and grandparents and brothers and sisters and moms and dads that have had some sort of electrical, thermal, whatever type of burn. You said frostbite, you don't think about that. What I ask you guys to do is to remember Sons of the Flag, that we're not here just begging for money, but our mission is real. The story is real and the programs are real. And if you need anything from us, you can always go to our website at www.sonsoftheflag.org. follow us on all social media. We really like to highlight and showcase all of our positive accomplishments. In a world that's filled full of so much negativity and hate, we want to be that bright, shining light that you guys have. And we're going to show you that what you guys have invested into us, it's real. And, everybody's real big on, return of investment. Well, this is your return on investment.
It is.
Zach Sutterfield is your return on investment. Those, every individual that we've ever dealt with through Mission Reconstruct, obviously the fellowship program, your money is at work. And if you want to see more of it, again, sonsoftheflag.org. There's a lot of great articles, a lot of great information for you to understand burns a little bit more. If you're interested in joining the task force, you can click the link. Greg Turnell is the task force director. Get with him, Sherry, or Landon, and we will get you on our team. We need more team members. We're not in all 50 states yet. We're still pushing hard to get there. We've got Hawaii, so
Nice.
we need the rest of the inland now. So we need everybody else to jump on board. But we've got one amazing team full of some of the most amazing individuals that are 100% passion driven about this entire mission. And so, from all of us at Sons of the Flag, Dr. Levi, I thank you for your time, and again, what you're doing for all of our, the burn care for all of our patients, and just what we're doing overall to make this world a better place. Because it starts with you guys. Like I said, and Sons of the Flag is walking with you along this journey. So thank you.
No, thank you. Honestly, just the gratitude to get to know all of you has been incredibly impactful. I know everyone on our team feels that same gratitude to be on a team with people like you. And, I think the future is bright because of the incredible minds and compassion and collaboration that really we have here. So thank you for this opportunity and for sharing this time with me. It's really been phenomenal.
Absolutely. If you guys want to check out more episodes, Fire Engineering, Blog Talk Radio, YouTube, look up Sons of the Flag. We do have them on our website also. Again, one more time, sonsoftheflag.org. Thank you guys for listening in tonight. As always, keep the mission first and just stay passionate. Thank you.
This podcast is brought to you by Firehouse Subs, the firefighter-founded hot sub chain with a passion for hearty and flavorful food, heartfelt service, and public safety. Ready for your next mission? Firehouse Subs is offering firefighters the opportunity to continue serving after service, now as restaurant owners. Learn more at Firehouse Subs franchise.